Welcome, everyone. I'm Luann Fortune. I'm faculty with the Department of Mind-Body Medicine at the College of Integrative Medicine and Health Sciences for Saybrook University. And we welcome you here today at the very first inaugural Saybrook Wellness Fair. And it is my pleasure to host this session that we're going to be offering right now on mind-body medicine for COVID recovery with Dr. Shannon Sims. Dr. Sims is one of our mind-body medicine graduates, and she also serves right now on our faculty. So we welcome you because you have some very important personal perspective on this, as well as the scholarly perspective. So I'm going to be handing it over to you, and thank you for presenting with us.
Thank you so much. Thank you, Luann. Thank you for that introduction. And I'm so honored and glad to be here with you all this evening or afternoon. So yes, I really would just like to spend this time just walking you through a bit of a journey. So as mentioned, I am a member of the faculty here with Saybrook's Mind-Body Medicine department. I am also an integrative wellness coach and a mind-body specialist, and I'm a COVID long hauler. So next slide, please, Luann. So like I said, I'm really hoping that this time here together will be, in part my sharing of my own personal journey through COVID-19 and also the professional journey that has come through that as well. And just speaking to the knowledge base also in mind-body medicine and really giving light to this emerging health crisis with a brand new community of long COVID patients who are chronic illness patients, and how this professional journey, this health journey has informed, how I orient to using mind-body medicine within my own life and also within my work with clients and patients, and bringing forward an integrative care model for these patients, not just COVID-19 long haulers, but also other chronic illness populations as well. So this is really where the journey begins, is with the self, right? Often, as journeys do. So I just want to take you back to a little over a year ago. So March 2020, the end of March, I was diagnosed with COVID-19. And just to share a little bit about what that experience was, I know this is becoming so much more common for people in the world, and maybe even for those of you who are listening in, maybe having personal experience with being sick, or maybe you have, or of loved ones who have been sick, or maybe even died as a result of the pandemic and the virus. So just to speak from the very origin of this, and in my own sickness, and I'm already seeing here in the chat we have other long haulers who've joined us. So this is really tapping into my heart and in a really meaningful place. So I made it through really without needing to be admitted to the hospital, and I thought I was doing okay. This is a very new situation for me. Oddly enough, I thought it was allergies to start, which is funny, because I don't actually have allergies. So I learned once I lost my taste and my smell that this was something that was no longer I could be trying to pretend was allergies. So the ensuing weeks after that, or days and even weeks of feeling this virus ravaging through my body, and meeting a whole slew of symptoms and issues that were coming with this, like extreme fatigue, really just extreme fatigue, and just not sure how my body was handling this. And so I saw several doctors at the time, and there's this term that some patients know as medical gaslighting. And so of course, at the very beginning of the pandemic, Doctors just did not know. None of us did. None of us knew what this was, what was going on, what was going to happen. But in many ways, I was feeling written off by the medical community that my lab tests were coming back completely normal. I had the best lab tests that they've ever seen in some cases. I did a stress test and it came back perfect. But the months following, I just knew that this what I was feeling inside was not normal. What was happening to me was not normal. I was feeling really uncertain about where what the future was going to hold, how my recovery would unfold, and also coping with a whole bunch of things that were really impeding my ability to live life. Just feeling intense anxiety, depression. I started experiencing panic attacks for the first time in my life, and all the while, feeling very isolated because so many people would meet me and say, "Wow, you're the first person that I know who's had COVID." I thought, yeah, well, what a thing. I'm also the first person who, I feel like I'm the only person in the world who's going through some of these things, and really feeling alone in the recovery process. And from the very beginning, from the very moment that I was diagnosed, I did not despair because I became inspired. Even in the midst of my darkest days of feeling sick and sleeping for 14 hours a day and physically unable to get up off of the couch, physically unable to walk up the stairs, um, that I knew that there were things that I could be doing to support my own health, to support my healing process. And that was through the mind body medicine practices that I have come to learn as a Saybrook student, and then also as a practitioner now in the field, and feeling so grateful to have that knowledge base and to know the science that supports the the health benefits and these self-healing modalities. So I really I amped up my own self-care practices, what I had been doing. I amped it up, I magnified it, I did it times 1,000 to whatever degree I could. And so I pulled on what I know of mind body medicine and these tools like meditation and guided imagery and biofeedback to tap into my own physiology, to to work with my health in a way that I know that I have autonomy over how I manage my health, and in these practices that I work with in my own self-care practice. And although there even still to this day is very, very little evidence with the application of mind body medicine in these practices specifically for COVID-19 in general, but let alone the recovery process through COVID-19. But knowing the evidence support for the immune boosting effects, the memory support, the stress management side of these tools, and knowing that there were things that I could be doing to support these problems and these issues I was facing, like the depression and the anxiety and the intense brain fog that was to follow for months after actively being sick, and then finding out how my heart rate was now reacting, um and my oxygen saturation, I had learned was dropping dangerously low when I would sleep. And probably I learned this maybe 3 months after being sick. But again, more invitations for me um, to discover and to remind myself that there are practices that can support my health. And so pulling on the evidence that we know from various mindfulness based practices and mind body practices, and along the way, after coming through the really sick days then shifting that focus on how I can be helping others who are like me, who are going through this, because I know how it felt for me to be incredibly isolated and alone and uncertain, and just all of the mindset stuff, and just the gremlins and the negative self-talk and all of that that I was struggling with at the time, and just the deepest desire to not want that for any other person, not any other long hauler on this planet would feel alone, and would feel like they were going through this by themselves. And so that's when I stepped into this place of how can I bring mind body medicine to the world in this way, and in supporting others who are moving through this health journey of their own. And so this ties in very nicely as well to the dissertation, to my dissertation work, which was I focused on medical students, but deploying a mind body skills training program for medical students, and taking a look at the impact of these mind body medicine skills and these practices on perceived stress, but also on the expression of cytokine, pro-inflammatory cytokine biomarker in interleukin 6. And not to get too into the weeds with that, but it's very interesting what we know when it comes to mindfulness based practices, and the release of pro-inflammatory cytokines in the body. And so something that we have learned from the effects of COVID-19 is, number one, that it ravages the autonomic nervous system, the central nervous system, and it triggers a hyper release, an over release of cytokines called a cytokine storm. So it's a normal immune response to initiate the release of certain cytokines in the body, but it becomes an overreaction of the immune system when there's too much of it, when it's overloaded. And really, what we're seeing here too is an overreaction of the immune system to the COVID-19 virus. And so again, just coming into what we know thus far as the COVID-19 being a virus that latches onto the autonomic nervous system, and also recognizing what we know from mind body medicine practices and the ability to elicit control over our autonomic nervous system by deploying these practices like autogenic training and meditation and biofeedback and guided imagery and hypnosis. All of these practices, just to name a few, that tap into the stress response, and that balance, that overactive fight or flight stress response, balancing out the autonomic nervous system with the relaxation response. So therein, comes this healing as well. So there's not great research on the impact of mindfulness based practices and cytokine, and pro-inflammatory cytokines, and the expression of cytokines. So there's a great need for research to be done in this area, and I'm looking forward to also seeing how, as a result of this pandemic, can also emerge new avenues for research, which is one area that I'm seeking to pursue as well. But let's go on to the next slide, Luann. So just moving on from here, just a bit, I wanted to share a few resources with you that I found to be really personally influential in through my own recovery process. I found guided imagery to be an incredible support. And again, just speaking to the research base in guided imagery, and knowing the powerful impact that guided imagery can have on recovery, and can have on the immune system. And so this was one thing that I really latched onto strongly in working with my immune system to mount a full recovery. And maybe some of you have heard of Headspace. This was a meditation tool that I found to be incredibly enlightening and really walked me through my own journey, and in just a number of ways. But one of the third and maybe most important pillars of these resources here is the Saybrook Mindful Moments that we started hosting as a university over a year ago now, at the beginning of the pandemic. Was really something that got me through some of the toughest, darkest days of my recovery, and even to now, and beginning here on Monday, we are coming back with our regular mindful moments on Monday and Friday from 9:15 to 9:30 Pacific time. So that is still ongoing. And so I really recommend that to anyone who's listening here and interested in adding another resource into their self-care practice. So next slide, please, Luann. So out of this personal journey, again, I mentioned that I was striving to create resources for support. And one of the ways that I had done that was creating a Facebook group for COVID recovery and support. And this is still ongoing. We have a growing community of people who are recovering from COVID-19. And this is a space where we enjoy supporting each other and in hearing about each other's journeys, and also providing resources. So, this goes beyond maybe some of the traditional support groups that you might find, where we're not simply just commiserating or, just simply, hearing about the struggles, and maybe hearing about successes, but also offering real tools for support and for recovery. So this is one place I really like to bring in not only just the research, but also to bring in practices like brief meditation practices, and guided imagery resources, and other tools that I have found, or that I work with, and can be a way for people to feel that there is something that they can do to assist their recovery. So rather than just feeling like a victim of this disease, instead, coming back into the driver's seat, because so often with chronic illness, and with my experience with COVID-19, it's sometimes feeling like, I'm not just in the passenger seat or in the back seat, but sometimes I feel like I'm locked in the trunk, like I have no control over what's happening to me, what will happen to me. I have no say in the matter whatsoever, and this is just something that I have to deal with. But instead, turning this into, bringing people into a place where they feel that they do have control over their health and their recovery process, and that recovery is possible. It's not just something that might happen, but it can absolutely happen. And another piece of this too, speaking to a more professional side, and my focus in coming into my role as somebody who supports, through my coaching work, through my professional work in meeting people where they are, and supporting chronic illness patients, supporting long haulers, long COVID patients. And one of the ways that I've been doing this is through Aila Health, which is a brand new, well, not brand new, but fairly new app that is completely free, and it is designed for chronic illness patients and for autoimmune patients to help them quantify and to track their symptoms, to expedite the diagnosis journey, so that they can keep all of their medical records, their health information in one place. If there's one thing that I really thought I wish that I would have had during my recovery process, and especially when I'm I don't know about anybody else who, on the call or listening in who's had experience with COVID-19 and possibly is a long hauler, but COVID has a myriad of symptoms, and it's not just like some, here's a few classifying symptoms of COVID-19. I mean, it's like there's this huge bucket of symptoms, and some days it's like there's no rhyme or reason to it. Some days, I would just feel like I'm you know s- emptying this bucket out onto the table and seeing what symptoms fall out, and okay, that's what I'm dealing with that day. It was so hard to keep track, and I did try, and I did in my own way through my own journaling and expressive writing practices. But how nice it would have been to have an app where I could really track my symptoms, and I could rate my symptoms and bring in the tools. A lot of us now have smartwatches. We have these devices attached to our body that track our physiology, that track our health, and to be able to bring that into one place, and also be able to take that not only for your own knowledge and information, and to see the progression of your recovery over time, but also to be able to take that into your doctors, into your physicians, and have your health information in one place is huge. So, and what we're also doing here is creating a community. We're creating a community of chronic illness patients, and connecting patients with other people who are like them, who are experiencing a similar health journey, and also connecting people with whole person care, connecting them with integrative mind body care, with coaches, with integrative physicians. So, next slide, please. And if there's one message that I really want to convey, is that recovery is possible. This picture was taken last month. I hiked a literal mountain last year. I felt like I was climbing, that metaphorical mountain as I was overcoming COVID-19. But last month I climbed a literal mountain, and one year ago I could not climb up the stairs. I couldn't climb up a single flight of stairs. Last month I climbed a mountain. Actually, to be to bring some numbers into it, I was wearing my Garmin smartwatch, and I ended up hitting my stair goal times 25. And I just think, wow, a year ago I I couldn't do one flight of stairs, let alone hit a stair goal. So that's really the message that I want to send home strongly, is that recovery is possible. And moving to the next slide, please. Oh, well, let's go back actually. Sorry, Luann. I may have added in an extra slide after I sent this one to you, but for the next minute or so, I would like to just take you through a short guided practice, just a short breath meditation to just to ground into this space. And so I invite you, wherever you are, to find a comfortable position. So maybe it's in the chair that you're seated, or perhaps you're on the floor or in the bed, wherever you are, allowing yourself just to settle in for a moment. You might allow your eyes to gently come to a close if that feels comfortable for you, or maybe taking a soft gaze. And allowing your attention to move into the body, the feeling of the body seated in the chair or the floor, or whatever surface is beneath. And allow yourself to pay attention to the breath, engaging with the breath, not trying to change it here, but just simply feeling that movement of the breath through the body, inhaling, feeling the chest expand, the belly rising. And as you exhale, emptying out the lungs fully and completely, and noticing how the body softens. Allowing yourself to continue to pay attention to this breath. Slowly and mindfully breathing. With each full breath, you're inviting your body to relax. With each full breath, we are triggering our parasympathetic nervous system, our relaxation response. We're sending that signal to our body that it's time to relax. Inhaling fully and exhaling completely. We calm our stress response, allowing the breath to expand and contract. With the inhale, we expand the diaphragm. And as we exhale, our muscles relax. And so does the mind. Allowing the breath to nurture the mind and the body. And taking in another full and nourishing breath here. As you start to come back to that feeling of the body, those points of contact between the body and the supporting surface. And as you're ready, allowing yourself to come back fully, maybe taking a stretch as you open the eyes. And we'll finish with the last slide. Just a few more words that I would like to speak with regard to other areas for support and community and connection. I am hosting an upcoming webinar series with the Aila Health team. And this is a 3-part series, and we are bringing together nutritionists and doctors and patient advocates from all around the world to offer insight and perspectives on with their expertise relating to living with autoimmune conditions and with autoimmune disease. So this is for anyone who might be interested. This is a completely free webinar that we're holding, and the first part of this series is kicking off next week, Thursday, May the 13th, and we have two more webinar opportunities following after that. But right now we're actually doing a really cool, we have a really cool offer. Anyone who's interested in signing up or who does sign up for this webinar, they're eligible for 1 month of free health coaching, offered by myself, in case anyone is curious. But you're welcome, and I would absolutely love to have you be a part of the conversation. and to just spread awareness on invisible illness and in chronic conditions. So with that, I think I will leave it there, and we can open up. I know we're already 2 minutes over our time, but if there's anyone who would like to ask a question, we can open it up for a little bit of Q&A.
Shannon, thank you. This was just amazing. And I'm going to pause the recording now so folks can offer up their comments and questions.